Hello, good afternoon, good evening, good morning and welcome. It's Nurse Richard the Wax Wizard. Thanks for joining me. Really interesting one this. This is a mastoid cavity that's a little suspicious, hence the title of the video. You might see a little reddened area there. I'm going to have a more thorough look at that towards the end of this procedure, which isn't that long. Always look weird, mastoid cavities. I know it fascinates a lot of you guys. This is our other ear, which is fairly routine. It took seconds to sort that one out. I wish the other one did, but it didn't. If you've never seen any mastoid cavities before, what they are, they usually happen when, this is the fine end tube, the bone behind your ear, the hard bit there, that's your mastoid bone, and if you get an infection in that, if it doesn't respond well to antibiotics, which a lot of these people, that's what's happened, it can get a nasty infection, and sometimes it just, the only way of dealing with it is to drill the whole thing away, which actually makes the ear canal wider. You kind of get this dead end at the side of it, so you'll have the ear canal there, then to the side of it they'll drill away that part there. So to get a look at that, you've got to put the camera in and then bend it round the corner. Very difficult to look inside these things, never mind do a procedure in these things. So I'm glad there was nothing to actually do in the cavity. A bit of a story behind this. This lady, she knew she had one. Some don't, believe it or not. I saw someone this morning with one who didn't know she even had one. She just says, I remember having some surgery as a kid, don't know what it was. Anyway, she went to see a GP because she'd been having trouble in this ear, which she doesn't hear much out of anyway. She could just tell there was something not quite right. There was a bit of discharge coming from it. So she went to see a GP the first time round, and the first GP she saw, because she saw two, said there was an infection. And they gave her some, I think they gave her some atomized spray, and then it didn't help, so she went to see a GP the second time, and a different GP said, no, it's not an infection, it's just you've just got a blockage of earwax in there. Now, I think they were both kind of right, because what you can see here in what is the normal ear canal is this chunk here, but it's mostly, it could be some debris left over from an infection, and it's obviously mostly skin, this like a little ball of skin. You see it's quite black behind it as well. Quite tricky to remove this. There wasn't really enough room to fit the full-size tube in there, not comfortably anyway. She was very nervous, this lady, bless her, but we managed to get that chunk out. Now what you'll see, it doesn't look like an ordinary ear. Obviously, it doesn't look like an ordinary eardrum as well. There's probably been some reconstruction there. What exactly they've done, I couldn't tell you, because I wasn't there. I haven't seen the notes, but obviously it looks a little unusual. It's foggy there. As soon as you put the suction tube in, that sucks out the warm air, so you can see it a bit clearer. Now, yes, there is a few black bits a bit deeper in this ear, almost beyond where the eardrum is. It's above my pay grade. It's going mauling around down there. There's too many things that can go wrong. For what benefit? Probably very little, but they might well need investigating. Obviously, I'm referring this patient to ear, nose and throat. For those darkened areas in those regions up there that you can see, but just as much for what you can see just to the left there. Now, it's very difficult to get a good look inside this, but you can see it's clearly red. It's possibly a little blistered. There has been some bleeding, and there is kind of a little pool of fluid there. So what's causing that? I don't know. Above my pay grade, I can hazard a few guesses, but there might well have been an infection, a little ulceration, and what's caused it, don't know. But I'm going to ask ear, nose and throat to have a look at this relatively urgently, just to see if they can get to the bottom of what might be going on inside that mastoid cavity there. So I'm just sure I was finding it uncomfortable, because like I said, you really have to stretch these open to stretch it and then angle the endoscope around to get a good look. Now, I'm not mauling around. I'm not even entertaining the idea of putting a suction tube next to that. Why would you? When it's clearly already been bleeding and there's fluid there. There's absolutely nothing to be gained from that when you refer them as an urgent ENT appointment. So let them have a look at that and deal with that under some more, what's the word I'm looking for? When there's a bit more clinical support around. I'm just here on my own here. Now, should anything go wrong when you start mauling around with things that are near your skull and your brain, you know, there's lots of things that can go wrong. So it's better done in an environment like an ENT department, where should anything go wrong, then there's people around there who can deal with something. So yeah, I'll remove that little blockage. That's not straight. It is straightforward. But the issue here is those bits need investigating. So let's let them look at that. I will keep you posted if I find anything out. I usually don't, I'm not going to lie. I get a lot of messages from people saying, what about an update on this? I would love updates and all of that. But the public health services are busy enough to do the job they're doing. Never mind ringing up someone in private practice just to say, oh, by the way, we found this. So I ask the patients, and if they let me know, I will let you know. But anyway, I hope you enjoyed that, found it interesting. But for now, take care of yourself, and I'll see you later. Ta-da.